And we're all set. Thank you so much.
All right. Ready for me?
I am. Thank you.
All right. So, hi everyone. Thank you to the Kellogg Cancer Wellness Center for having me here. I primarily work with patients who have lymphedema or at risk of developing lymphedema. So oftentimes when I get asked by my patients, like, why didn't I know about this sooner? Or why hasn't anyone told me about this before? So I'm really glad to be here to share all of this information with you all today. There we go. Okay, so here are our goals for the presentation. The first one is to know what lymphedema is and what the system does. Second one is factors that may lead to higher risk of developing lymphedema. 3 is knowing your own personal risk and knowing what habits to promote that lymphatic system going. And number 4 is steps that you should take should lymphedema occur. So lymphedema has been known to trigger some fear and some anxiety around it because not a lot of people know about it. While I was in school, it wasn't really anything that was very focused on. And so we hope by the end of this presentation, you have a greater understanding to help you with challenges post-cancer treatment as a cancer survivor. Okay, so before we can be empowered, we need to go back to the basics. What is lymphedema? So lymphedema is a condition of localized fluid and tissue swelling caused by a compromised lymphatic system. It is lifelong. Currently, there is no cure for lymphedema, but it is manageable, as you'll learn later on. Versus when we see edema after surgery, for example, it's expected to self-resolve, although it may take some time, and due to the extent of the surgery, the swelling does resolve over time. So there's a difference between lymphedema and then generalized edema. Okay, so with my patient population, primarily I treat patients who have secondary lymphedema. And what that means is there is a diagnosis or trauma to the body that came first, and then in turn it overloaded the lymphatic system. So for example, those that are listed there is like surgery from a lymph node dissection, radiation, increase in a BMI and you're overweight, an infection that happened acutely, and for those with lower extremity swelling due to venous insufficiency. So that means that your blood can't bring up, your body can't bring up the blood back up to your heart. Over turn, you get secondary lymphedema. There's also something called primary lymphedema where it's in your genes and it can occur at any age because they were born with a poor anatomical design of their own lymphatic system. Okay. So here is an example of before and after treatment of secondary lymphedema. This is someone who has chronic venous insufficiency because you see this discoloration. And so something that we do here is you'll learn later on what it can look like after treatment. And then for most of you who are at risk of developing upper arm lymphedema, that might be secondary due to breast cancer related, right? If you see over to this arm over here, it's a little bit bigger, and then this is what it can look like after. So what does the lymph system do, and why do we need to worry about it? So the lymphatic system is composed of lymph fluid, lymphatic vessels, and lymphatic nodes. So the 3 main duties is to fight infection, and second one is to transport fluid back into the blood circulation, and number 3 is to filtrate waste products produced from cells. So the lymph fluid, it's right underneath your skin, it's superficial, it's colorless, and it's transported through the lymphatic vessels, these green ones over here. and then it drains into the lymphatic nodes. These lymphatic nodes contain white blood cells that break down the bacteria and the virus even further. And the nodes help to drain it deeper into your system, where it goes back one to your blood circulation. And also some of it goes to your liver and your kidney, and it gets filtrated even more. And then it goes as a part of your bowel and urine. So I often get asked, where does the lymph fluid go? And the quick question is, you pee it out. All right, so we often break it to body parts. So for the upper quadrant drainage, which is a lot of my attendees over here, so the lymph vessels transport that lymph fluid in the upper body, which include your breast, your arm, even your upper back over here. They all drain into your axillary lymph nodes. And so if you've had an axillary lymph node dissection, that area is at risk because it's gotten removed, and therefore all of that is not draining properly into this area over here. Versus if you are at risk for developing lymphedema in the legs, that all drains into your groin area. So you have your inguinal lymph nodes, where that also not only covers your legs, but it also covers your buttocks and your lower part of your abdomen. And so, like I said, part of it drains back into your abdomen. So you have a bigger lymphatic vessel. It's called your thoracic duct, that's located in your abdomen, and that connects to your kidneys and your liver, and you get rid of it as waste products. And so this is very important in terms of trying to flush that fluid in your abdomen through deep diaphragmatic breathing. Probably a lot of you heard other benefits, but this is one too, is to stimulate your lymphatic system. So first exercise of the presentation, I want everybody to try to take a deep breath through your diaphragm. And so what I would say is inhale through your nose, make your tummy get bigger, and then exhale through your mouth. Exhale, and then put your navel into your stomach. So I say inhale through your nose again, smell the roses, and then blow out the candles. Taking 5 to 10 deep breaths is really good throughout the day to just get that going. Okay, so a little bit more on how lymphedema occurs and why you need to worry about stressing the lymphatic system. So to help everyone understand, I often put it into an analogy. Your lymphatic system has a maximum load capacity. It can only take so much before it gets overloaded. So we use the analogy of a dump truck, right? Because it's your infection fighting system, it's your filtration system. And so if you overload that lymphatic system, what happens? That all of that load gets spilled over, and therefore you develop lymphedema. Another analogy that I would use is you want to clear out that system first. So like in the beginning of the traffic area system, you want to clear out the front before you overload and keep backing it up. So really important to note that you don't want to overstress that lymphatic system, and you want to keep all of that stimulated. So what does it look like? The obvious one is swelling. So as you could see here in the picture, this is what you call pitting edema. So when I press onto a skin, it divots, and then it doesn't rebound back up, like goes back into your normal skin. And so that's a clear telltale sign of someone is developing edema. But others have subclinical symptoms, which means it's not so obvious in the visible eye, but they are reporting symptoms of pain, stiffness, numbness, and tingling. So those are some symptoms that you want to monitor and make sure that you are kind of being aware of, and then maybe bringing that into a professional setting of like, hey, these are my symptoms. Is it lymphedema or is it something else? So you guys have a handout that was previously probably emailed to you guys. And this is a really good just worksheet of just keeping your symptoms in check And over time, and then obviously giving and providing that to a medical professional, and then allowing them to assess you even further. All right, so let's pause here. Does anyone have any questions regarding just background knowledge of the lymphatic system?
And if anybody has questions, for those of you new who just joined us, please feel free to use the chat box to send questions throughout the program. Also note, and I did put this in the chat, handouts will be shared at the end of the program.
All right, so I'll move on for now. So now let's talk about risk factors. So not everyone is at high risk, at moderate risk, at low risk. Not everyone is at risk. So knowing what those personal risk factors are. Let's start here on the left-hand side. These are unmodifiable risk factors, things that you cannot change because it's the treatment you receive in order to get rid of that cancer, right? So research has shown, and again, this is more related to breast cancer related lymphedema because there's more research out there. And then we could transfer that knowledge a little bit into more of like head and neck or probably like a lower lymphedema. But for now, this is for breast cancer related lymphedema. Okay, so if we'd have 5 or more lymph nodes removed, that increases your risk. Also, the extent of your cancer treatment. So whether you've had radiation, chemotherapy, the surgical lumpectomy or mastectomy, or even implants being placed under as well. Those increases your risk of lymphedema. Those are surgical traumas to your body. And another one is genetics. Whereas here on the right-hand side, we talk about modifiable risk factors. What are some precautionary measures you could take to take matters at your own hands and change some behaviors? And so we'll go over this a little bit more clearly, but skincare, you can definitely take care of your skin, keep it nice and moisturized and clean to prevent any more infection and trauma to the lymphatic system. BMI is also known to increase your risk. And so if you are taking healthy measures to do a healthy diet, exercise a little bit more, that's all up to you. And then things like that. So we'll go a little bit further into that. So when we talk about that unmodifiable risk factors, I want you guys to know, are you at high, medium, or at low risk, right? So I often break it down into 3. How many lymph nodes did you get removed? How much surgery and treatment did you have? And then what is your BMI pre-surgery? Like how much of an activity level do you have? So say that you've had 5 or more lymph nodes removed, or some of them get all of them removed. And then 2, say that you've had chemotherapy, radiation therapy, and then lumpectomy or even a mastectomy. That's a lot. And then the third one is if you're coming into surgery with a high BMI, those are caused to known to have high risk. Those are my high risk population. But say that you are very active before coming into the surgery and you have a normal BMI, but you've had maybe 1 to 2 sentinel lymph nodes removed, which is the gold standard nowadays to prevent lymphedema, and then maybe just radiation and no chemotherapy, I would say you're at like medium risk because you hit 2 out of those 3. Versus if you've only have like a low risk of like a sentinel node biopsy and then no complications afterwards, you're definitely going to be at that lower risk level. So knowing high, medium, or low. So then we talk about modifiable risk factors, precautionary strategies that you could take. I want you guys to know that there is mixed research out there about what you can and cannot do. So, but according to North Shore and the Medical Advisory Committee, we do still follow those precautionary strategies. And so we have a handout of all of those that you guys should see. So again, healthy lifestyle, right? Making sure that you're getting your medical checkups in time and you're closely monitored, making sure that that's under a guidance of a professional who knows that you're at risk of lymphedema. Utmost important skincare. Again, your lymph fluid is right underneath your skin. And so if you, especially over the winter time, right? If you're super dry and you have abrasions in your skin that you don't even know of, and you're not moisturizing to keep a protection under your skin, you are introducing bacteria to a compromised lymphatic system. So I want all of you guys to take care of your skin. The other one is knowing signs of infection, which I'll go over later. And then other ones that I've had before is like air travel, extreme temperatures, putting like wristwatches on, or like doing some heavy lifting. Those have mixed research on them. And so again, knowing whether you're high, medium, or low, I want you guys to either be proactive or very flexible about it. So this is what we follow, the National Lymphedema Network. So they have a website that you guys can check out, and they update constantly on what they recommend for patients who are at risk of developing lymphedema and how to be proactive about it. And this is still what the National Lymphedema Network says, that skincare, the limb constriction, the extreme temperatures, the air travel, all of that should be a precaution. So what research really focuses on is how much exercises really decreases your risk of developing lymphedema. Why does that make sense? Well, if your lymph fluid is right underneath your skin, it's also sitting on top of muscle belly. So if you are not constantly, but if you're exercising and contracting those muscles, for sure you are moving lymphatic fluid as well. So people think that they come to my therapy and then we do a lot of manual lymphatic drainage, which is great, but exercise has more research behind it. So I definitely am encouraging my patients to do these exercises. And here are some simple ones that everybody can do that's not going to be hurtful to you. And so I'll demonstrate a few. So starting off with your neck motion. Besides your abdomen, another like secondary like lymph node site, like that's high, is above your clavicle. So I often want to start here first and get those lymphatic nodes going, right? And then we'll do some shoulder rolls up and back. I never say forward because we're always in a forward posture, but think about up and back, shoulder rolls, and get that going. Yes, I see some of you guys demonstrating with me. Love it. The other one is shoulder blade squeezes. Get that posture going. Open your chest. After surgery, people are so often tight in their pec. And so doing these shoulder blade squeezes to retract those shoulder blades back is really good. And so we're opening up this system, we're clearing the front of that traffic, and then now we're gonna go distally, so towards your arm. So maybe doing some rows forward and back. And you wanna go nice and slow and gentle, right? Good. And then bending the elbow and the wrist. I'm backing up so you guys can see me here. There we go. I like to make a fist, and then I like to open out. Again, you have some lymph nodes here a little bit in your elbow. And so we're working on waking those up and getting those going. I love little stretches that you can do, right? So I am bringing it forward, feeling a nice stretch through here. That's nice. This one shows circles. I often see this. I'm not a big fan of it because something starts hurting and it feels heavy. So another way to do it is laying down, and you could put your arm up and do circles that way. Again, if something hurts, I'm not a big fan of it. So find a way to modify and do the exercises pain-free. And then opening and closing the fist. Some of my patients who have lymphedema, like an early onset, they often see the swelling starting in the back of their hand. So doing this hand pumps is really good. Good. Okay, so then for those who have secondary lymphedema due to chronic venous insufficiency, the blood, the veins and the heart and all the arteries do not do a good job in bringing that blood back up to your heart. So you get swelling in your leg, and then the lymphatic system gets overloaded. So you still start with these neck motions because, again, the secondary part of high lymph node area is in your neck. So I'm still opening that up, clearing the traffic here in the front end, really working that out. And then we can go to the leg exercises. So as you can see here, some of the exercises are laying down, but if you do like a knee to chest to each leg like that, you could just think about doing even just bridges, right? And you could even do these standing. You could do it laying down like the picture, or you could do it seated. So again, different ways to modify. Heel slides, those are great. Bridges, again, I'm really cautious about giving bridges in the very beginning because if you're pulling your lower back and you're just trying to hike it up, that's not a good way to do it. Clamshells, you could even do those seated of opening and closing your legs, because what are you doing? You're opening up like that groin area where that inguinal lymphatic nodes are located. And then the fan favorite for decreasing swelling in the legs is ankle pops. So bringing your ankle forward and back and doing some ankle circles. So even if you don't have true lymphedema and you have swelling in your legs, moving and exercising is still enhancing flow. Okay. So I talked heavily about exercises, about how that's researched and a lot of research to back that up. But the other ones that I talked about, skincare, increase in temperature, the air travel, those have mixed research. And so if you're at low risk, I want you to really be flexible and just think about the balance of quality of life versus really being afraid to travel, or being afraid, oh no, I got like a flu shot and I totally forgot about it, or a blood pressure cuff here. Like, it's not to say that it happens once and it's going to blow up on you, right? But where are you at that benefit and risk, and know that you could be proactive about it and do something about it, right? And then again, knowing to seek medical advice. Like, the whole point of this presentation is for you to gain better awareness, and it's not like I could get it down to you guys in 45 minutes of a time. And so it's just bringing that first set of education and then coming forward to a medical professional about it. Okay, so that's your risks, your personal risks. Is there any questions so far that I could answer before I move on?
The one question that came into the chat is the Webb axillary syndrome permanent?
Okay, so I think, are you referring with like cording, like a tight pulling?
I think it was a little bit earlier in your presentation.
Yeah, so the cording, the thought process behind that is it's a blocked lymphatic vessel. It's a buildup of fluid, and therefore you see like a rope, like that's common, that we do treat here. And the goal is to not break it. Sometimes it breaks when we're doing manual lymphatic work, and oftentimes they find relief after. But research has shown that the cording is not like a precedent to lymphedema happening later on. And so whether it's permanent, it depends per person. Sometimes while you're in therapy, we are decreasing how prominent that cording is. Sometimes we get to release it. And so if you are living with cording, really the true main goal is to not let it affect your function, to make sure that it's not limiting your reach. So think about a rope through here and then having something tie you down. And so that's often like a rope, like is the symptom or the report that I always get. And so the main thing is not to let it affect your reach. And so whether it's permanent or whether it's temporary, it really depends on the person.
And another question that came in, the exercises you pointed out, is there a benefit to doing these before surgery, or is it better to wait until after surgery?
That's a great question. Oh my gosh, I am such a believer of pre-op, the benefits of setting yourself up to the healthiest level that you can be before you put yourself into, you have to, like, into surgery, really promotes a good prognosis afterwards. So I would really promote healthy lifestyle before, during, after for the rest of your life. Anything else before I move on?
No additional questions. Thank you so much.
Thanks, Serena. Okay, so let's move on. So what to do if swelling occurs in that area at risk. So call your physician to determine whether medical issues could be the cause of the swelling, or and making sure that you are aware of those symptoms, log those symptoms, and go to a professional about it, right? It's manageable. It's not something to be so triggered about. At least you guys know what's happening, and then we could seek help for it. On the other side, really, really important, everyone, is to know the signs of an infection. So this is an acute reaction. It's not something that you wait to call and hear back from the doctor. I want you guys to know signs of an infection of the arm or the leg. So redness, oftentimes it's like a whole arm, or it can start out from a small size, and within 2 to 3 hours, that redness can spread. That's a sign of an infection. Warmth, also you'll just feel like crap. Flu-like symptoms, fevers or chills, you'll know that you're having a whole systemic infection, and you guys need to go to an immediate care immediately, not something that you wait on. Typically people also have like crazy pain with this. So please know the difference between a gradual onset of lymphedema versus an acute, like an infection of the involved arm or leg. Okay, so getting on to what I do and my colleagues over here, treatment for lymphedema. Okay, so there are 2 phases of the treatment that we often do. The first phase is the intensive phase, where my main goal is to reduce that limb to a stable size. And then the second phase is the maintenance phase. Like I said, lymphedema is lifelong. So what are the things that you can do afterwards to keep that limb down? So the first part is everyone's favorite, which is manual lymphatic drainage. It's a very nice light massage to tell that fluid where to go. So we reroute. So say that your axillary lymph nodes are affected over here. You have a compromised arm. And so we're telling that lymph nodes to flow away from that spot. So I often teach my patients how to do this themselves so that they could do it 1 to 2 times daily. And this is really the main thing that we do for an affected arm that is maybe 2.5 centimeters more than your other side. We do compression bandaging. It has the fastest results. And so we're creating pressure to decrease you to a stable size. It often comes with a lot of layers. And so some of my patients get really kind of overwhelmed with this, but it's safe. You have to wear it until you see your therapist again, and then we rebandage, and then we keep trying to rebandage until you go back into a stable size. I guess gift wrapping is a very nice way to put it, but yes, it'll feel very bulky. And then you get into that long-term management phase. Once we get you down into a stable size, we often get you fitted for a medical grade compression sleeve or stocking. And I reinforce this to, if it's your first time getting a compression garment, please do not get it off of Amazon. Sometimes I've seen, some are good, but some cause like undue like binding at certain parts. I don't know why the fabric is like that, but it's supposed to try to emanate that you are causing distal pressure here, highest here to here, so that you're pumping fluid this way. So we send out our patients to community local vendors, and they get fitted over there where we give you the right pressure to use. More on exercises. And so there's really a lot of research out there that it puts you at risk if your BMI is higher than 25, that you're at higher risk of developing breast cancer related lymphedema. So this is something that you guys can change after as a survivor. So here's a picture of my mommy. She involuntarily did the little exercises with me, but I often like exercises that hit a lot of muscle groups at once for those who have a busy lifestyle or who don't really like to exercise but want to do it so that they can be more proactive. So I'll go over these. So the top one, you want to either you have weights or not. So I would start maybe with a 1 pound or something like that, where you reach here, you inhale up and you open, and then you exhale down, and then you go slow. So again, incorporating that deep breathing of you inhaling up and exhaling over here. Okay, and then the other one, often say like a cheerleader or like taking out your sword, so you're in this diagonal pattern. It hits a lot of muscle groups. Good. Versus the one on the bottom, we're doing like pulling out your seatbelt kind of thing, where you are reaching across the other shoulder, going across your chest, and then opening it up this way. So if you want to do it with no weights, that's completely fine. You could think about grabbing that seatbelt and then opening out, inhaling over here, and then exhaling out. Good. So this was part of my doctorate clinical study or research to see what's out there. And there was really a big research on doing like weightlifting group and doing more of like low loads, high repetitions over a period of time. And they compared it to those who did not join the exercise group, and clinically significantly 11% more at higher risk of developing lymphedema. So that was huge. I have patients who love yoga, so I looked into that as well. Again, this is more of like, if you do yoga and you know the basics of really not hurting yourself, then yes, you can go down into doing yoga again after treatment, right? But then it's progressing slowly. And so if you feel like you're putting so much weight on like a down dog and there's causing pain, then how do we modify that? Maybe we go to the wall and then we maybe go down like this instead of putting all of your weight down there. So I think it's more important to work with someone who knows or who could see it from the side, who's trained or can modify these exercises for you before you get into it right away. And yep, if I haven't stressed that enough, I think another one that I say is start with low weights. And if you can get to 3 sets of 15 without feeling a thing, then you could progress the weight, or you can even increase the resistance. So I think that's really helpful. Like if you guys are trying to get into weight training, I would start like 1 to 2 pounds. All right, 3 sets of 15. And I don't want you to do it every day. I would say every other day. You don't work out a muscle part every day. You want to have muscle recovery. So maybe every other day doing like a certain body part, right? And then if you don't feel any, you've stayed with that weight for like a whole week and you don't feel anything, then that's a good indication to maybe go up 1 pound or something like that. For those of you who have lymphedema already, we do want you to be wearing that right throughout the day. So that includes exercising as well. Okay, so other facts about lymphedema. Some of my patients come in and they're using diuretics. For true lymphedema, it might be actually harmful because it's stripping away the water, yes, but your lymph fluid, which is made out of protein, it's not stripping that away. So oftentimes it's the protein lymph fluid that's left over, and then people are like, why am I still swollen? Well, because the diuretics are causing more harm to your body. Another one is another harmful one that I saw was with air travel. Like people think that they have to wear a compression garment so that they can contain any undue swelling that might happen when they travel. Yes, however, if you are not getting fitted for the proper one, it really does cause more harm than good. So I want you guys to be aware of that. The other ones like acupuncture, dry brushing, rebounder, vibration plates, mixed research, not a lot of research out there. So I'm not one to jump on that wagon. Tai Chi, yoga, yes, go for it as long as you guys are doing it under good instruction and you have good background on it. Other ones that are up and coming is kinesio tape, low laser, level, and compression pumps. Again, I would just seek out medical advice first because it's really pertaining to you and what your body can do, and you can't do that over a presentation. With compression pumps, I like it. However, if a person is not exercising enough or not having, if they're sedentary, for example, those two words do not come out of my mouth, especially in treatment, because I want them to move first and to exercise first before they rely on a compression pump. All right, so for example, for me, I have CLT, that is the credentials, Certified Lymphedema Therapist. I'm an OT, I'm an occupational therapist. And so at the Skokie and Evanston location, we are all occupational therapists. There are those who are physical therapists that can also be certified in lymphedema therapy. So just depending on that part. And there's also massage therapists that are certified lymphedema therapists. They focus obviously more on the massage part, and they don't do a lot of the teaching and the skilled occupation or the skilled intervention. So that's the training that we have. And again, all in all, to just find that this education is the first step and knowing where to reach out for more questions and help. And so if you guys have general questions or need to make appointments, you need to first get an order from the doctor that would indicate PT/OT lymphedema referral. And one of our doctors here at North Shore that specializes in lymphedema, his name is Dr. Joseph Feldman. And so that's his number right there if you guys wanted to get a lymphedema consult. All right, thank you. That's the end of my presentation. Any questions? How am I doing on time?